Thank you so much, Madam Chair, and to this committee for your tireless efforts here, and to the incredible staff for supporting you through the night. As my colleagues have said here, I am just baffled at the reason this committee would start a hearing at 1 o'clock in the morning to hear amendments and testimony on a bill that has such significant impact on the American people. We are responsible to the American people, and transparency is at the heart of what we do. Republicans are doing this because they know that this is bad. It's the same reason why when the president pulled Republicans to the White House when there were holdouts on the budget proposal, that he told them just to close their eyes and vote for it. Just close your eyes and get there. The same reason the Budget Committee called people back at 10 o'clock at night to do this work in the middle of the night. Well, I'm not closing my eyes. I'm paying attention to every single thing that is in here that is going to hurt hardworking Americans like those back home in West Michigan who I represent. I am paying attention. And I'm offering amendments that will help take us down a different path. I've offered several amendments here today that protect working families, our Great Lakes that I proudly represent, the largest freshwater resources in our entire country. But we only have time to focus on one, so I'm talking today about my amendment number 66 that makes the Enhanced Affordable Care Act subsidies permanent. These subsidies are one of the most effective tools we have to make health insurance affordable for hardworking families, middle-class Americans, and those who fall into the coverage gap just above traditional Medicaid eligibility. This amendment eliminates the previous income cap that cut off subsidy eligibility at 400% of the federal poverty line so that no family is forced to pay unaffordable premiums just because they make slightly too much. It also maintains a sliding scale cap on how much of a family's income they're expected to contribute to their premiums, ensuring no one pays more than 8.5% of their income for coverage, and in many cases, significantly less. What does that mean? That means that a family of four making $125,000 a year can still afford quality insurance without facing crushing monthly premiums. It means a self-employed contractor with variable income isn't penalized for working hard. And it means that millions of Americans who don't qualify for Medicaid but can't afford private insurance have access to care. Without this amendment, those enhanced subsidies are set to expire at the end of the year. If you're at home listening to this and you thought this was all about Medicaid, think again. Your premiums could go up significantly. When these premiums expire, over 4.2 million Americans are projected to lose their health care coverage. That's according to the nonpartisan Congressional Budget Office. Millions more will see their premiums double or even triple. We are staring down a cliff, and my amendment pulls us back from the edge. In my home state of Michigan, these subsidies have helped hundreds of thousands of people afford health coverage. That includes families with children, small business owners, those who are self-employed and part-time workers. If we let these subsidies lapse, people in every single one of our districts, red and blue, are going to feel the impact. We better be paying attention. At the same time, this budget plan slashes nearly $1 trillion from Medicaid. As we know, those proposals that threaten coverage for nearly 14 million Americans, including children, seniors, people with disabilities, and low-income families. While one side of the aisle is proposing taking health care away, I am working to keep it. This amendment offers a responsible, proven way to keep people covered. Let's not forget, these subsidies work. We've shown that they work. They've reduced the uninsured rate to a historic low. They have brought down premium costs. They've given people peace of mind in moments of crisis, whether facing a chronic illness, job loss, or pregnancy. Making these subsidies permanent is not only the responsible thing to do, it's the moral thing to do. It's pro-family, pro-worker, pro-stability, and it is a fraction of the economic cost and the human toll that we will pay if millions of people lose their coverage. We need to be asking ourselves, why? Why are we doing this? We have the resources to cover the healthcare coverage that we need if we will just tell the billionaires that they need to pay their fair share. This tax plan will allow the top 1% to get an additional $700 a day.
Thank you, Ms. Scholten. Thank you.